Hey guys, so I got banned for it's a dangerous acts. They thought I was driving. I'm not driving. I forgot to take my seatbelt off. I was just sitting in the car. Um, for those that have questions, go ahead and continue to ask those. I'm happy to continue answering them. I know that the biggest questions are typically about the spread of virus despite being vaccinated or um, or unvaccinated. And again, it's a numbers game. So trying to reduce the amount of spread as well as the chances for a mutation are really the reasons for vaccination as well as putting on a mask. So it's all about a numbers game, trying to reduce as much as possible the complications and spread of the virus. So that's the main concern. Thank you all for joining back. Yeah, I got kicked off there for a second. They thought I was driving, and I guess TikTok or somebody reported me for dangerous acts, even though I'm not driving the car. So feel free to ask away with your questions. Just try to jump back on here real quick because I know there's some questions that were asked, and I just had some questions that were asked from the previous session that I didn't get to answer, so I thought I'd come back on here real quick. Anesthesia question: I have tracheomalacia. Is it okay to have nitrous at the dentist? So it depends on your extent of the tracheomalacia. Now, it also depends on, do you have a trach in place now or ever, and what the cause of your tracheomalacia was. If you don't have a trach in place and you just have a weakened trachea, as long as there's no evidence of collapse, usually nitrous is okay. You still spontaneously breathe, and it's usually not a very deep level of sedation, so it shouldn't affect your airway and your trachea too much. Uh, Call me Katika. Thank you for your kind words. I don't let them bring me down. I just trying to get the information out there, and I just wish more people would try and uh, appreciate the information that is out there and actually be able to utilize it. And I feel like a lot of it's coming down to people just digging their heels in and not wanting to get vaccinated, which is fine. They're allowed to do that by choice. But I think it's turning more into people just not wanting to do it because they don't want to be told what to do, as opposed to having information out there. So your wife got her third booster. That's great. I hope she's doing well. Hopefully, she didn't have any reaction to the vaccine there. El Jefe, go Niners, go Niners. No trach collapse at the Carina. Um, and I also don't know this. So sick and tired 59. I don't know the setup for your dentist office. I don't know if there's anesthesia present. Um, Usually nitrous again is okay. It's more of like a moderate sedation. You just kind of feel a little giddy. It helps you relax a little bit, but you're not completely under general anesthesia with nitrous alone. But with the using CPAP at night, as long as you're not in a deep sleep, deep sedation, or general anesthesia, your airway should still be open. Now, if there is an anesthesiologist available and they have the ability to do positive pressure ventilation for you in the event your trachea collapses at the carina there, that would obviously be beneficial to you. I don't know the capabilities at the facility that you have though. How many jabbed are getting it? I don't know the exact numbers, but in terms of an actual number, I don't know. I'd have to look up the number, but the percentages, it does seem that about 10% of those appearing to the hospital are vaccinated. The other 90% tend to be unvaccinated. So there is a heavy um, preponderance of those that are getting hospitalized that are unvaccinated. It's almost a 9-to-1 ratio. Can you talk about multiple COVID infections, like it could live dormant like shingles? To my knowledge, I haven't seen any data suggest it lying dormant. So, like with the shingles or herpes type viruses, they lay dormant in the ganglions of your sympathetic nervous system typically, and they can be reactivated. The COVID virus doesn't seem to do that. Basically, the idea is that if you had received it one time and recovered, that possibly your natural immunity has waned enough away, and if the mutation that comes out with Delta versus Alpha, if it's enough of a change where your body doesn't recognize it quickly, then you might become slightly symptomatic again. But in terms of like reinfecting yourself or the COVID living within inside you and that being the source of a new infection, I don't believe there's any literature out there talking about that right now. We'll never get the vaccine, and that's fine. I'm not here to force the vaccinations on people. I just want people to have the current information that's available to us. Is HIV in the vaccine? No. Commonly see that on here, and I also see that fetal cells are in the vaccine, and that's not true either. So the research for vaccines started from aborted fetal cell lines back in 1970 from an abortion from the Netherlands, as well as another line that came across for vaccine manufacturing in 1980s from an abortion in the Netherlands. So no further fetal cells have been, I'm sorry, no further abortions or terminations of a conception have occurred for vaccine research. These all are lines that have been used from the initial cell lines that were received back in the 70s and 80s, and have the lineage can be tracked back to those specific cells. But these new cells are not embryos or fetuses, they're just identical cells that are used for research. Eat Mo Pie 1. That's fine. Yeah, I love current info. Just put my input in. That's fine. And that's why I try and keep it as open as possible in here. What is the ingredients list on the vaccine? So, obviously, the main ingredient is the active ingredient. And for Moderna and Pfizer, it's the mRNA. And for Johnson and Johnson, it's the adenovirus. The full list, which actually isn't terribly long, can be found on the manufacturing websites, the FDA, and even the CDC website. And for the most part, a lot of the things on there are pretty common in most vaccines. And for those that might be contraindicated to get a vaccine would be those that have significant allergic reactions, meaning anaphylaxis to polyethylene glycol for those that would be considering Moderna or Pfizer. And then polysorbate may be a cause of anaphylactic reaction in Johnson & Johnson. So if you're allergic to those, then that might be a reason for you to discuss with your physician if there's any other options for you. But usually it's basically masking and trying to protect yourself with social distancing at that point. Let's see here. There is no test for Delta. Well, so there is a test for Delta. It's just not as widespread as the point of care testing or PCR testing that you see that helps us decide our clinical judgment and decision making. So it doesn't, at this moment, there's no real reason for us to differentiate between the two when we're taking care of a patient. Now, what happens is those samples get sent off from the positives from given hospitals, then they collect from multiple hospitals at the Department of Health in your state. And then they run more specific tests that actually can tell which variant it is for epidemiologic reasons, not for clinical changes or clinical management. And that information, what they do is they look at the percentage or proportion of the variants in the area. And then once they see a new dominant variant, and now we're hearing a lot about Delta, the Delta variant, they will come out and say is now X percentage of the cases that we're seeing. And then usually as the new one comes along, it's works through the community, and they'll start to slowly see a trend of it taking over as the major strain in the area at that time. Does not list trade secrets. So trade secrets don't apply to patented information. Patents have lifespan, and when that's up, people can infringe on that. Trade secrets are not under copy or patent law, so that's a whole different thing. Trade secrets are like what Coca-Cola has for their formula. Their formula is not patented; it's intellectual property, but they didn't patent it because then it can be public information after a patent wears off. So they're completely different things. Hydroxychloroquine. So there was data in the beginning that said it could help as an outpatient, but for now, the data for that, as well as ivermectin, just does not seem to really help all that much, and the risks are likely outweigh the benefits. So, do the spike proteins in the vaccine attach in your blood vessels, causing blood clots? So, when a blood clot forms, you usually need a couple of factors. It's called Virchow's triad, and some of the components of that are you need an inflammatory response, which can be mediated by the virus. You need endothelial dysfunction or damage, which is the lining of the blood vessel, and then something that starts the cascade, which is an interlinking of all of these things. So when you have all three things present, and tissue damage, when you have these three things present, it starts the cascade for a blood clot. Now, the vaccine can cause that to happen, but it's exceedingly low, less than being a smoker or somebody taking birth control or being immobile after surgery. All three of those things, which people do much more frequently, have significantly higher risks than getting the vaccine. And then if you compare that to the high risk of getting a blood clot from actually getting COVID, it's not even close. So using the argument of the vaccine causing a blood clot to not get the vaccine, you're more likely to get a blood clot from getting COVID. So to you're much more likely to benefit from getting the vaccine than not getting the vaccine if your argument's worrying about blood clots. So I actually don't know the answer to this question. I haven't seen literature talking about this, that Pfizer weakens normal immunity over time. I'd have to research on that. I haven't seen any literature come across any of my emails or journal articles that really discuss that. Do we have a better treatment for those hospitalized? So a couple of the things that are helpful are listed on here. Decadron helps the inflammatory response, particularly those experiencing cytokine storm, which is usually the younger patients where they have a robust immune response to the point where it becomes counterproductive and can harm organs. As you move down the list, you have antivirals. Remdesivir seems to help, and then in conjunction with the steroids. As you go further down the list, you start getting into the more specified things like the monoclonal antibody treatments. Some things like this, as well as Regeneron, can be helpful. And then as you get down here, you get to some of the more exclusive monoclonal antibodies. And those can be helpful to help bind to the virus's surface to prevent it from going into the cells and damaging cells, as well as allowing for further replication. But unfortunately, there's not great treatments available. It's still a lot of symptomatic and supportive care. And there are a couple of things that try and reduce the severity, but nothing's great, and absolutely nothing is anywhere as effective as getting a vaccine and preventing it altogether. If I could tell somebody that's hesitant to get the vaccine one thing, what would it be? Well, first of all, it depends on what's making them hesitant, because then I can speak with information to reassure them. But I think the one thing would be that considering all things, the risks of the vaccine are exceedingly low, and your benefits of getting it, not just for yourself, but for the overall population, almost certainly outweigh the risks of getting the vaccine. So that's usually what I would say to somebody. So ethylene glycol is different than polyethylene glycol. It's not antifreeze. Polyethylene glycol is actually used for colonoscopy preps. So if you make statements like that, at least know what you're talking about. Never getting it if you can spread COVID with it anyways, it's redundant. So the idea isn't um, about complete elimination, because nothing in life is 100%. That's medicine or outside of it. The idea is reducing the trade, the ability to transmit it to somebody else or to cause a mutation. So again, I'm not trying to convince 6J33456 to get the vaccine. All I'm saying is that the information that's out there suggests heavily that the vaccine is effective, reduces the risk of spread and severity, as well as hospitalizations. Let's see what else we got here. So Amy Fordyce 8, sorry if I'm saying that wrong. Chances if you're on a ventilator. I'd have to go and see if they have any new data, but earlier on, the survival rate was pretty abysmal, probably in the teens, maybe 20s, sometimes lower, depending on, also depends on the patient. Um, if you have a younger person who you would have otherwise thought that they wouldn't have been on a ventilator, but for some reason they did, they have a little bit more reserve. Their organs started out at a healthier place, so they might have a better chance. But if you have a older individual, elderly with multiple comorbidities who goes on the ventilator and is deteriorating quickly, their chances are very, very bad. Probably less than 5% chance of survival once they're on the ventilator. So, let me see here. Did I get vaccinated? Yes, I've been vaccinated. I got Pfizer. So, but theirs shows death to the, I think somebody talked about to the vaccine. And again, I talked about this earlier that there's reported deaths from the vaccine, which no matter what, however you say it, is sad. Death is a death, and it's not good. But when you compare it to the amount of people dying from COVID and all the benefits of people being vaccinated, both as an individual and to our society as a whole, it will outweigh that. And then if you also compare, I've seen different numbers people try to quote, and I have to go look up the number myself because I don't really look at VAERS too frequently because it's self-reported and it's not verified. But I've seen 15,000 to 50,000. Either of those numbers is a very, very small percentage when you compare it to the billions of doses of the vaccine that have been administered. That's a very low complication rate. Still, I mean, people have died, and like I said, that's always sad. But the amount of good that comes from being immunized outweighs the risks for almost anybody. In my 60s, immune compromised, had full blown COVID. Stop fear mongering. Well, I'm glad that you survived, you had COVID and you're immunocompromised. Again, nobody's ever said that everybody who is immunocompromised and over 60 will pass away from COVID. There are cases of it, but when you look at the overwhelming majority of information out there, those that are high risk or elderly are going to have a problem, and unfortunately, the result of it can be mortality. High risk or elderly are going to have a problem, and unfortunately, the result of it can be mortality. Need to be aware of, not you individual, but the public, that you can have these cases, and obviously it's absolutely great when people can survive, but the overwhelming majority of cases, that's not the case. So somebody just asked if they had COVID, what's the benefit of getting the vaccine? So actually, the new Israeli study that everybody keeps quoting about natural versus vaccine immunity is showed that the third leg of that trial looked at those that had been subjected to COVID and recovered and then got the vaccine. They had the best overall response in terms of antibodies, not just antibody total, but also longevity. So if anything, this new article that people are touting against vaccination supports vaccination even further, including for those that have already had COVID. Now, natural immunity does work, and nobody's going to argue that, but the problem is we don't know how long it works for, and now we've got studies that are starting to say different things. With the Israeli study, the information hasn't been verified yet, so we have to be cautious with how we interpret that headline. I read it's the 32-page article that I read the other day, or paper. So the total information is not out yet. They do have their tables and demographics listed, but they don't have all of their data out there yet. And there are some limitations listed in their own discussion that they admit to their own studies that people should also be aware of, and they can take a look at the article. But basically, it talks about how the higher risk individuals were probably the ones that were in the vaccination group, as they're the ones that got vaccinated early on. So not only are they high risk, and you're comparing it to a general population that has a lower percentage of high risk patients, but also their immunity was more likely to fade away because they were vaccinated earlier on. And also, it only looked at the Delta variant. So it looked at the immune response and antibodies produced from the Delta variant. They say to not extrapolate that to other variants because you can't know for sure how high an antibody level would be for individuals that may have had the Alpha variant and what their protection level would be. The clinical trial hasn't been ended. It ends on 2023. I don't know which clinical trial you're referencing. The clinical trials for all of the major manufacturers, particularly Pfizer and Moderna, have been wrapped up for quite some time now. They actually finished their phase 3, which is the large trial that looks at safety and effectiveness before you can even move forward with widespread use of the vaccine. The only reason they got to move forward was because of emergency use authorization, and that was based off of 2 months of data that were reassuring and only allowed to have emergency use because of how many people were dying and being affected by COVID. Not just deaths, but long-term comorbidity or morbidity from it, neurological problems, lung problems, heart problems, all of those types of things, blood clots. So there was a real need for them to try and allow the vaccine to be used because of all of the problems that people were having. So, hold on 1 second. Let me read this comment. Where is the safety data for vaccine after COVID found? I'm not quite sure what you mean by that. You mean for people that get vaccinated after having COVID? Well, that's what this new study from Israel kind of looks at. The data for that subpopulation of those that had already had it, there's not going to be any great data yet because that's a subset of individuals that have not been vaccinated and was not part of the initial study. The study obviously looked at those that didn't have COVID for the most part, or those that were high risk and got vaccinated. So you don't have the power or the numbers from those initial studies to look at the long-term effects from those that had it and then got vaccinated. But for the most part, again, it goes back to the risk-benefit analysis, and those that are high risk are almost certainly going to do better from getting vaccinated than not being vaccinated in terms of complications as well as chances of dying. So there's people saying on here that 10 years there will be a lot of side effects. The problem with that thinking is that there's never been a non-living vaccine, and there's quite a few of them that we use regularly for widespread vaccinations. That's popped up 5 or 10 years later as having a problem that was unidentified during the studies. So this idea that something's going to happen 10 years from now is not warranted, and it's also disinformation, disingenuous, and could be harmful to not allow a vaccine to go out for all the people that the vaccine is helping now versus a completely hypothetical and likely non-existent risk 10 years from now. I just talked about the long-term studies. Getting a lot of comments, and I'm trying to stop the feed so I can read some of them. I'm harming people by lying to them. So I'm not sure how I'm lying. This is all scientific data that's easily available to everybody. And all we're trying to do is help those out there that would like to have access to current data. And there's a lot of people out there that are on the fence about being vaccinated because of the disinformation that's out there. And a large percentage of people, if not the overwhelming majority of people that are vaccinated, receive immunity, about 90% effectiveness, and the complication rate's exceedingly low. Thank you for speaking the truth. You're welcome. I'm just trying to pass along current data for those that want to hear it, and I'm not here to shame the people that don't want to get the vaccine or let's see here. Do I have a moderator? I'm working on adding moderators actually. The ingredient list. So the ingredient list, and I've talked about this before, the active ingredient for Pfizer and Moderna is obviously the mRNA, and then the active ingredient for Johnson & Johnson is the adenovirus vector. The other inactive ingredients are ones that are common in other vaccines, and you can look those up on the manufacturing websites, the CDC, the FDA. Just Google it yourself, you can find it. The other thing is the only real contraindication this time for vaccination is a severe reaction to the first shot for those who have an unknown reaction, should not get the second shot, or for those that have anaphylaxis type reactions to polyethylene glycol, which is not ethylene glycol or antifreeze, as somebody mentioned earlier. Polyethylene glycol is different, and it's used for colonoscopy preps. If you have an allergic reaction to that, then you should avoid the the Pfizer and Moderna vaccines. If you have a history of allergic reaction to polysorbate, then you maybe want to avoid the Johnson & Johnson shot. So ID specialist talks about the Pfizer only 65% effective on new variants. So the data varies by study, but there are other studies that say that it could be up to 90% effective, and it's absolutely better than not being vaccinated. It's not the same situation as what you see with the flu, where a prior vaccine that's 9 to 12 months old is no longer effective essentially at all, and this is better than nothing. And if anything, the data for that was used for prior vaccinations that could have been months ago. If patients receive a booster shot, it's likely to increase the efficacy of the existing antibodies. There are aborted babies and HIV in this. Not only is that uh, not appropriate to write on here, but it's not true. I already discussed this. The fetal cell lines that are used for vaccine development and manufacturing came from two abortions that occurred in the Netherlands in the 1970s and then another one in the 1980s. They can be tracked back to that initial embryo. There have been no further conceptions or abortions that had to occur for the research that we're having today. That is a complete fallacy. According to VAERS, how many have died as a result of the vaccine. So I'd have to go look at that data. Like I said earlier, I don't really look at VAERS too frequently because it's self-reported and it's not verified, but I've seen people write on here anywhere from 15,000 to 50,000 deaths from the vaccine. And absolutely, that is a lot of people. And nobody's going to argue that it's not sad that they passed away. But when you compare it to over a couple billion doses of the vaccine being given, and the fact that 60 or 640,000 Americans have died and millions around the world, the death from the vaccine is exceedingly low complication. What about people with heart palpitations? If it's just heart palpitations, you're absolutely fine to probably go ahead and proceed with getting vaccinated. Talk to your doctors first. If you mean atrial fibrillation, where you're high risk for blood clots, I would be hard pressed to believe that your cardiologist manning your blood thinners would not suggest you getting the vaccine. You're already higher risk for getting a blood clot, hence why you're on blood thinners. Your risk of getting a blood clot from being infected with COVID, particularly if you have to go to a hospital with any interruption in your anticoagulation, would put you at a far higher risk of developing a blood clot and complication from getting COVID, as opposed to the small risk of a blood clot from the vaccine. So their lives didn't matter. I never once said that their lives didn't matter if they passed away from the vaccine. What I'm saying is that the complication rate is exceedingly low compared to billions of doses of the vaccine being given, and it's kind of strange to me how people point to the vaccine, but there's no empathy for those dying from the virus. I mean, everybody wants to talk about the amount of people dying from the vaccine, which is anywhere from 15 to 50,000, whatever people are talking about. But those same people have no empathy for the 640,000 Americans and millions that have died around the world, and they're not willing to get vaccinated. That's all I'll say about that. I'm not talking about that talking point anymore. It's been beaten to death. I'm allergic to penicillins. What about that? To my knowledge, antibiotic, allergies, and penicillins should not be a contraindication to you, but I would also talk it over with your physician. But typically, no, the penicillin allergies should not be a contraindication to getting vaccinated. It's typically anaphylactic reactions to either the inactive ingredients that are in other vaccines that you've had a problem with before that overlap with the current vaccines, or, like I said before, polyethylene glycol for Moderna and Pfizer, or polysorbate for Johnson & Johnson. Pregnancy and vaccine. So the most recent guidelines from the American College of Obstetrics and Gynecology says that the recommendations are for high-risk pregnancies and for high-risk workers, meaning people in nurses that are in nursing homes or healthcare providers that would be at high risk for contracting COVID from somebody with a very high viral load. Now, when you compare the data showing the complications from COVID from those individuals that are pregnant, it's actually pretty astounding. And you should actually go and Google the relative risks for infection, maternal and fetal mortality for those that had contracted COVID. Almost without a doubt, the vaccine is going to protect you and also have much, much lower risks for the mother as well as their child compared to getting COVID itself. So it might actually attack a growing placenta in early pregnancy and lead to complications, either with a spontaneous abortion early on or termination of a pregnancy later. And we're just not seeing that, period. The vaccines are much, much better um, for protecting than they are for harming the individual. And when you compare it to um, getting COVID itself, it's without a doubt better. 50,000 deaths is acceptable. No, no death is acceptable, but where is your outrage over the 640,000 COVID deaths? I mean, I don't understand that type of comment. It doesn't make any sense to me. All right, I'm going to answer one more question, then I'm going to go ahead and hop off for now. Infertility, I talked about that one. If you have contracted COVID, how long after? So if you've contracted COVID, how long after can you get vaccinated? So sometimes they'll tell you as long as your symptoms are gone and it's been about 2 weeks, the clinic who administers it might give it to you. Other places have protocols in place for 3 months, particularly if you had severe disease and received monoclonal antibodies. So usually it's about a 2 week period. You might hear different from your individual doctor or your clinic there, but for the most part, it's usually going to be 2 weeks after you have recovered, and or 3 months if you're severely ill from it and required monoclonal antibody therapy. All right, so I'm going to go ahead and jump off here now. You guys have a great day. Hope I answered some of your questions. Um, get vaccinated. It's going to be helpful for everybody. I hope you all stay safe and have a great day. Thanks.